These are the contents of the infection control in dentistry. The definition is it is also called as exposure control plan by OSHA. It is a required office program that is designed to protect personnel against risk of exposure to infection. Sterilization is the physical or chemical procedure to destroy all microorganisms, including substantial numbers of resistant bacterial spores. Sterilization means the destruction of all life forms, as given by Ronald B. Rutfig. Sterilization is the process of killing or removing all viable organisms. A sterile surface is one where it is free from all living microorganisms, usually described as a probability. That is the probability of a surviving microorganism being 1 in 1 million. Disinfection is the disruption of pathogenic and other kinds of microorganisms by physical or chemical means. Disinfection is less lethal than sterilization because it destroys the majority of recognized pathogenic microorganisms, but not necessarily all microbial forms. Disinfection is a process of removing or killing most but not all viable organisms. Disinfectant is a chemical agent used on inanimate objects to destroy virtually all recognized pathogenic microorganisms, but not necessarily all microbial forms. Asepsis is the prevention of microbial contamination of living tissues or sterile materials by excluding, removing, or killing microorganisms. The modes of disease transmissions are that there is direct contact with blood or body fluids, indirect contact with contaminated instrument or surface, contact of mucosa of the eyes, nose, or mouth with droplets or splatter, inhalation of airborne microorganisms. The modes of transmission include infectious agent, reservoirs, portal of exit, means of transmission, portal of entry, susceptible host. All of these form the chain of infections. The objectives of infection control is to reduce, implement, simplify, and protect. Why is infection control necessary in dentistry? Dental staff and patients may be exposed to a wide variety of pathogenic microorganisms. Each member of the dental team must follow the recommended guidelines. What should be done to prevent the transmission of disease in the dental office is, firstly, there should be hand washing, gloves, face masks, protective eyewear, protective clothing, instrument sterilization, and disinfection. Diseases transmission in dental office includes the dental office should have an infection control program to prevent transmission of disease from the following: patient to dental team to patient, patient to patient, dental office to community, community to dental office to patient. To prevent such infections, following is a list of all these procedures and precautions that together constitute infection control. These guidelines should be followed each time treatment is performed because we are never certain of the patient's status, either because they themselves do not know or because they have chosen not to inform the healthcare providers of their condition. Following these guidelines for every patient is called standard precautions. Standard precautions include immunization, patient screening, hand washing, barrier techniques such as PPE kits, rubber dam, pre-procedural rinsing, needle and sharp instrument safety, occupational exposure to blood and body fluids, instrument sterilization and disinfection, surface disinfection, radiographic asepsis, laboratory asepsis, infectious dental waste management and disposal. Personal protective equipment or PPE requires the employer to provide employees with appropriate personal protective equipment. Examples of PPE include protective clothing, surgical masks, face shields, protective eyewear, disposable patient under treatment gloves, heavy duty utility gloves. These PPE must be used whenever you are performing tasks that could produce splash or splatter, any contact with body fluids, perform other clinical activities that require handling contaminated items, example radiographs, impression dentures, or contaminated equipment and surfaces. Hand hygiene involves hand washing, which is the single most important procedure for preventing the spread of infection. So you must wash your hands each time before you put on gloves and immediately after you remove gloves. Hand washing is also required if you touch contaminated instruments or surfaces during working. You should always use liquid soap during hand washing. Bar soap should never be used because it may transmit contamination. Hands need to be cleaned when they are visibly dirty after touching contaminated objects with bare hands, before and after patient treatment, before glove placement and after glove removal. In the dental operatory, environmental surfaces, that is a surface or equipment that does not contact patient directly, can become contaminated during patient care. Certain surfaces, especially ones touched frequently, example light handles, unit switches, door knobs, can serve as a reservoir of microbial contamination, although they have not been associated directly with transmission of infection to either personnel or patients. Transfer of microorganisms from contaminated environmental surfaces to patients occurs primarily through personal hand. Infection control during the pre-treatment period. The process of infection control begins during the period of preparation for clinical treatment. Paying attention to infection control at this time has several payoffs. In addition to reducing the risk of transmission of infectious agents during patient care, thinking ahead will make the treatment session more efficient and will also make the post-treatment infection control process easier and more effective. Remove unnecessary items from the dental procedure area. The dental procedure area should be arranged to facilitate a thorough cleaning for each patient. Pre-plan the materials needed during treatment. Set out all instruments, medications, impression materials, and other items that are needed for the procedure. Thinking ahead minimizes the need to search for additional items or to enter cabinets and drawers once gloves have become contaminated. The use of disposable items saves time during cleanup and decontamination and solves the problem of proper reprocessing. Use pre-arranged tray setups for routine or frequently performed procedures helps to eliminate the need to go into cabinets once you have started a procedure. Use individualized sterilized bird blocks for each procedure. Using individualized bird blocks containing only the birds required for that procedure helps you to eliminate contamination of other unneeded birds and to make cleanup easier. If indicated, have the rubber dam stamp set up on the tray when rubber dam will be used during a clinical procedure. It should be included on the tray setup. In addition, include those items needed for high velocity evacuation. Identify those items that will become contaminated during treatment while preparing the dental procedure area prior to beginning a clinical procedure. Consider which items will become contaminated during treatment. Examples of such surfaces include countertops, light handles, X-ray unit heads, tray tables, etc. Decide whether to use a barrier, example plastic wrap, to prevent contamination of these surfaces and items or to disinfect them when the procedure is complete. Surface barriers are used to prevent contamination on the surface underneath. All the surface barriers should be resistant to fluids in order to prevent microorganisms and saliva, blood and other fluids from soaking through the barrier and reach the surface underneath. Review patient records before initiating treatment and place radiographs on the view box. Do not leave the record on the countertop or handle it after beginning treatment. Place the record in a drawer or out of the dental procedure area so that it does not become contaminated. Entries into the record should be done before and after the procedure. Prepare personnel involved in patient care. An essential pre-treatment procedure is the preparation of all personnel involved in patient care. This includes the utilization of personal protective equipment and hand hygiene.